Hi everyone, it's Dr. Svehlak. I want to introduce to you a new procedure, a combination of procedures that I've come up with, and I'm calling it Snatched by Svehlak. It's a combination of procedures where I'm giving your mid and lower face and even into the neck more definition and improved contours. It can include all or some of the following. Contouring of the neck and jowls and jawline with liposuction, and it could also include something like Renuvion. Secondly, it can include a buccal lipectomy, where the little fat pads in your lower face are removed to help give you more definition in the lower face. And thirdly, it could also include some fat transfer, fat grafting, where fat can be placed into the cheeks, into your lips, along the jawline, and even the chin, again to help further refine facial features, mostly from mid-face down into the neck. So if you're interested, come on in, we can talk about Snatched by Svehlak and see if it's right for you. Hi, it's Dr. Svehlak. I'd like to talk about a very simple procedure that people come in for facial contouring. It's called buccal fat pad removal or buccal lipectomy. This type of procedure addresses that fat pad in your lower face, usually right in front of the masseter muscle. Some people are concerned about the fullness that this causes in their lower face. So the simple procedure is buccal lipectomy. This can be done under potentially local anesthesia right in the office, where a small incision is made on the inside the cheek after injecting numbing solution. The fat pad is located in there and carefully teased out from inside the cheek on both sides. The fat pad is then removed. A couple tiny stitches on the inside the cheek that dissolve. The whole process takes about an hour or so. Postoperatively, there's some mild swelling. Rarely is there bruising. It's slightly sore. And the full effects usually take about 8 weeks or slightly longer to get that full effect of the changes in the lower face. So if you're interested in this type of procedure, come on in, let's talk about it, and we can go over the different options. Thanks. You know, we always worry about as we get older, we're looking a little more age, we're getting a little more wrinkles in our face, we're getting more hollows, and so on. And so we always think about rejuvenating the face. Common treatments that everybody usually hears about are fillers or injectables like Botox. You think of Restylane, you think of Juvederm. There's lots of different products. However, there could be some issues where it looks overdone. These products sometimes can migrate. There's another option. It's very common. It's been done for many, many, many years. Probably don't hear about it as much. And that's just using your own fat, doing facial fat grafting, or transferring fat from one part of your body to your face to improve those contours, to rejuvenate the areas that have lost volume. This type of procedure can be done right in the office very easily under local anesthesia and a little bit of oral sedation. Maybe you're getting a little older and things aren't looking as refreshed and youthful. This is another option. If you're thinking about this, come on in, make an appointment. We can talk about it and see if this is a good option for you. Thanks. Hi, it's Dr. Svehlak. Common procedure that I get asked to do is to fix belly buttons. I get a lot of young women who come in and we're very self-conscious about the way their belly button looks. So the procedure is relatively straightforward. We do it under a local anesthesia in the office, create a nice, any natural looking belly button. Recovery for this is pretty straightforward. The very next day, you could be up doing regular things, take a shower, drive your car. Have you been unhappy with the way your ears look or the shape or position of your ears? Well, there's a really simple procedure. It's called an otoplasty. And what that is we can do a simple procedure right in the office under a local anesthesia. We numb the ears with a few little injections, and then with a carefully placed incision behind the ear, I go underneath there, we manipulate the cartilage, reshape the cartilage, use some suturing to maintain that shape. Each side takes maybe an hour, so it's about a 2-hour procedure in the office. We put a little bandage on, and when you're done, you're able to go home. In a day or two, we take the dressings off, and it actually looks pretty good almost immediately. Eventually, it takes several weeks to totally heal completely. So if you're concerned about the shape of your ears, come on in, and let's talk about otoplasty. A common procedure that I get asked to do is to fix belly buttons. I get a lot of young women who come in and we're very self-conscious about the way their belly button looks, such as this person here. Her belly button has extra skin and it protrudes out. And she just wants it to look normal so she can look good in a bikini. So to repair these, we usually do these in the office under local anesthetic. I inject some solution around the belly button, make a very precise incision, change the shape of the skin. Sometimes I remove some of that skin, internal stitches to pull that skin down and make an innie, and then some fine stitches on the surface, really try to hide that scar in the belly button. Case, very similar, extra skin around the belly button, create a nice innie, natural looking belly button. Recovery for this is pretty straightforward. Usually for a couple weeks, you're gonna minimize any really strenuous activity, but the very next day, you could be up doing regular things, take a shower, drive your car, just limiting any excess strenuous activity for about 3 to 4 weeks.